Dr. Lulu, it is so great to have you on the podcast. We've been trying to do this for a few weeks between our schedules. It's nice to finally have you on. I have spent the last few months bringing practitioners like yourself onto this show, given that I feel like these are important conversations to have as far as being able to empower people to live healthy lives, given the state of the world that it is, kind of with what's going on in the population. And then also this explosion of chronic disease that seems to not be going down, but kind of skyrocketing, and having these tools to be able to
Right.
either prevent getting there or managing and getting back to health when you are there, that these connections are seem to be kind of missed. And so I appreciate practitioners like you who are willing to come on the show and talk about your expertise as a naturopath, different than kind of the traditional model. So again, it's an absolute pleasure.
Oh, thank you so much for having me, Brandy. I'm super excited to be here today.
Great. So I love to just start these with kind of your backstory. Tell me everything that you do within your practice, but also why? Why did you choose this route rather than the traditional route? Because I feel like everybody has a reason.
Right. Yeah, that's totally true. And I'll keep it brief. I won't go to my entire life story. But yes, so I think, for me, I really grew up in a kind of like a healthy household. My mom was super into health. And so that kind of, started my genes, so to speak, is like a really great kind of like foundation for health.
Mhm.
And so I always have had that passion. And I don't really have the story of like, what's a good example? Like some physicians or naturopathic doctors will have this backstory of like they became ill and they wanted to then pursue a career in medicine to help others like themselves. That really hasn't been my specific, story or background, but it really comes from a place of just this love and passion for wanting help people feel better, to help them find their true place on the planet of this complete health and wellness, which I know is super attainable for people, and when I started to see the differences, like, okay, if you're given this perspective from an alternative health model, it can completely change as opposed to coming from this traditional allopathic model, which is completely viable in a emergent environment, where if you need emergency care, this is when you need to have that allopathic doctor on your team, right? When you're in the ER, for example. But when it comes to chronic disease, that model fails every time. They're just not given the tools because you have to look at the body completely holistically, right? You can't just treat the symptom, which is what they're doing. You have to really dive deep into the root cause. And chronic disease has many different root causes. Many of the systems are out of balance, which leads to many different symptoms, which is what people come in with, which was one of the reasons why they're so hard to diagnose. Because, it's like, you have 40 different symptoms on the plate, and that can lead to different things like, oh, maybe you have this, maybe you have that. So you have to use a lot of diagnostic tools and be the detective, and I love being that, which is one of the reasons why I think I dove into the naturopathic field. And I really love, I know one of my biggest passions is food and nutrition, and that kind of like was my seed before I even became a naturopathic doctor. I was working in the natural foods industry, I was working at a yoga retreat center, and I really fell in love with when people are shown how to eat like great food, the differences it can make in their life. So I still practice that in my practice today with patients. It's a huge aspect of what I do. And it's really not about taking away because I
Yeah.
see that, patients often find that when we take away a lot of their food sources, then they feel like they have nothing left to eat. So it's really about like putting really good food in. So anyway, yeah, I think that's kind of like my passion really comes from helping others from this true place of people that are lost. They've been on the road where they just don't know where to turn because all the doors have been shut, right? No help, no hope, no hope. And so
Do you
then,
find that the people that make their way to you, you are their last resort? They had tried every other option, before, and then finally it's just like, okay, well, I'll give this a try,
Right.
Do you find that that's kind of the case in your practice?
Yeah, I find that a lot, especially because I really focus on deep chronic disease. And,
Mhm.
we're trained as um, family practitioners, so we can see a wide range, a variety of diseases. But then a lot of us will specialize. So, because of my specialization, I then receive clients or get new clients that have a lot of quote unquote baggage, right? They're
Yeah.
carrying in all these different things and they have lost, like, they've just been there's so many different variables that they're coming
Yeah.
in with that they have had a lot of turning away, like, oh, there's nothing you can do, or they've also have tried many different things, and then maybe a friend says, hey, have you tried naturopathic medicine? It helped me, right? I think that's
Yeah.
usually how most of my referrals come from.
So I find that in many of the practitioners that I've spoken with, and even in my experience with my own health, is that there is a bit of a lack of general education on what health is, what it means to be healthy, how important food is, how important limiting stress is, how important your lifestyle is, how important removing toxins is, all of it, the bigger picture. Um, and I find that when we finally make it into the realm of natural medicine, functional medicine, integrative medicine, etc., that you're like, so you're telling me I have to eat healthy, um, change my limit my stress, like these very basic things, and it feels almost ridiculous. Because there isn't that foundation, like you said, you had growing up, this foundation of this is what it takes to truly set this foundation of health and wellness, right? Do
Mhm.
you see that a lot, that there has to be an education portion of it?
Oh, totally. And when we're in medical school, naturopathic medical school, one of our huge foundations is docere, which in Latin means doctor as teacher. And
Mhm.
I would say that's like 75% of my practice is educating patients, and it's like you said, that foundation of health is
Yeah.
key. And that's always where I start, and sometimes, like you said, it does seem like ridiculous, but when we're stressed out or when we don't feel healthy,
Mhm.
those are the things that go out the window first, right?
Right.
So then if we look at bringing those back in, it's amazing how quickly we can see results.
Well, and this is something I've spoken about on this show before and in other episodes, is that, we kind of have this conditioning in our current society of, okay, this is the problem, give me the pill for it, and I should be good, right?
Right.
It's a lot of work to change these habits, to change these things, to take your health into your own hands. But I also find that it's very empowering in itself too.
Hmm.
If when I found my practitioner and she gave me these tools, I was one of those people that was like, "What? That's nuts. No, just tell me what to take and, I'll feel
Right.
better, whatever." But she was amazing in being able to say, "Hey, no, this is the foundation. You've got all these other things going on. It's a complete imbalance. We're going to target these areas, and we're going to do that with food, and we're going to do that with really reducing your stress and kind of this emotional baggage that you've carried around and all these other things." And herbs and, you name it.
Right.
And it feels a little kooky until it starts working. And then you're
Right.
like, "Oh my gosh." And then you kinda go in this journey of, "Wow, that's really empowering. I get it now." And I
Hmm.
feel like it's very sad to me that that's not the basis of our education system in our homes, in our schools,
Right.
etc.,
Mhm.
of making these the foundation of what we're learning as little people and even big people.
Right. Yeah, that's so true. And I think that that's a really, you hit on it, like a key point there is about community. And that's
Mhm.
one thing that I really work a lot with. And when I work at the Veterans Healing Farm, one of the places that I work, it's about, when we teach others, you know, how to do something, then it like trickles out into their environment, into their community, and they
Yeah.
can help others. And we've lost along the way a lot of that because, like, as you mentioned, that quick pill fix,
Yeah.
right? And I think that when that started happening, I think it was in the 20s when we had the surgeons or resurgence of the AMA and allopathic traditional doctors, and then the alternative care, kind of took the wayside because they had pharmaceuticals coming in and things
Yeah.
that people could find quick relief with. And because of that, then we lost our roots for traditional medicine, that family thing, like, oh, hey, grandma says I should take this, right? Well, there's a truth to that, you know?
Right, kind of this wisdom that's been passed down of, herbal teas or bone broths or whatever it is.
Mhm.
Johnny has a tummy ache, so we're gonna give him this herb or this
Right.
lemon tea or ginger, or kind of these very basic tools that have been, like you said, kind of lost. And so we've also lost the sense of community, um, which is a huge part of wellness.
Right. Oh, huge part. Yeah. And
Yeah.
family and community is how not only how we spread the knowledge of health, but also as our support system, which I think
Mhm.
we've seen, a lot with COVID over the past
Yeah.
15 months is, having that support system when you have to have it virtually is a lot different, and
Yeah.
now I think we're opening back up into a way where people can be like, oh, okay, so we have this great thing established. How can we then further put it back into our community and start to help that healing on a
Yeah.
more global level?
Yeah, it's been very interesting to me, and I commented to my husband just the other day. I was having one of these very frustrated moments of thinking back to these last 15 months, and it seems to me that it's been a wasted opportunity.
Mm,
A wasted opportunity in the sense of we have this explosion of chronic disease. We have this explosion of illnesses, obesity, et cetera, that lead to these very detrimental outcomes as it relates to COVID. And instead of saying, "Hey, we have a problem here," the people that are seeing these terrible outcomes are the ones that we need to be focusing on getting this education to, and saying,
mm,
"Hey, we really need to get to the bottom of why this is happening and what
right.
we can do to fix it." And it feels very frustrating to me that that opportunity has seemingly been wasted, in my opinion. I haven't
Mm-hmm.
seen it as much as I've wanted to in the mainstream of
Mm-hmm.
focusing on overall health for people, emotional health, mental health, physical health, as it relates to these poor outcomes. So that
Mm-hmm.
not only, if this virus goes through the population, any virus for that matter,
Right. Yeah.
you're going to have better outcomes and handle these these things in nature if you are in great shape
Right.
emotionally, physically, etc.
Mm-hmm.
I mean, how do you see, I mean, do you see, am I crazy? Have we wasted this opportunity?
I don't think it's wasted. I think that we're still seeing a lot of the after effects and the fallout, so to
Yeah.
speak. I think that people are just now surfacing in a
Yeah.
different way, and they're still trying to figure stuff out. Like most of my patients that were already feeling some stress and anxiety, that has gone up like 100%.
Yeah.
And then new people are surfacing that they're like, oh, this was a time that I was able to have that introspection. Now I need to really take charge of my health. And I've seen a great difference in the new population of patients because there's definitely a time period where
Yeah.
everybody was like inward, it's like,
Oh, sure.
and so that was a good time for people to have that reflection. And so I think that it hasn't been missed. It's actually just starting. I
You're
think,
right. I mean, now that you put it that way, you're right. It's kind of like we've been underwater this whole time, and
right.
you're right. We're just kind of coming to the surface and like, okay, what
Yeah.
just happened? Let's figure
Right.
this out.
Yeah. And I think that we'll be, as people are also seeing
Yeah.
the after effects, especially when it comes to stress, because stress
Yeah.
is such a huge component that people are still dealing with
Yeah.
now. The financial aspects that they've suffered, that chronic stress is so important to deal with now. Right. And
Yeah.
to help them in a way to recover and to have the tools to deal with the stress, which is just, I think, the hugest part of COVID that I've seen.
And that's really interesting that you say that too, because it doesn't get spoken about a lot.
Mhm.
That stress aspect, that emotional aspect of um, having a physical effect on people. So that
Mm,
emotional stress kind of manifests as this physical response too, where
mm.
it's just kind of, your immune system goes down and then you're susceptible to all kinds of things. Um, so I want to go kind of back to the basics here. Can you explain what exactly naturopathic medicine is and how it's
Sure.
different? Like, what are the principles
Right.
of naturopathic medicine? How is your approach to your patients different than the allopathic model?
Right. Yeah, that's a great question. So, I think really we're just talking about the real core foundation of naturopathic medicine, it's about treating the root cause of the condition.
Mhm.
And from that perspective, then everything kind of seeds out. And so we taught in medical school all the modalities that are from like herbs and homeopathic medicine and nutrition and diet and exercise and counseling, the whole holistic picture, which is very different than a traditional medical model. We're not looking at the body from one perspective, we're looking at the whole body. And then we use those modalities we're taught to do all different types of things. When I see patients, it's not just, I'm like, here, take this one herb. And, that's not what I do. I look at every aspect of the patient. Like, how's your mental health? How's your emotional health? How's your physical health? It has to be that whole picture because, the emotions are a huge component of how our body functions. And then we have to look at the history. That's a huge component of how I practice. And with that functional medicine perspective brought in is what's the timeline? Did you have something that happened to you when you were 6? Maybe you were on antibiotics for 3 years as a child. That's
Yeah.
going to completely affect your gut health. And those things aren't looked at from the allopathic model. They're just not. I mean, maybe I shouldn't say like just not. It might be, but a very small, minute percentage of doctors do that perspective.
I was going to say, I don't think I've ever had a physician ask me about my childhood.
Yeah, it's very low. And then from my perspective, I use genetics. That's like my passion. And so I use all of that naturopathic tool and knowledge, and then I add a genetic component because for me, I love working with genetics. I find that it really helps patients to see a new insight of their inside,
Right.
right? And but also it gives us a great preventative model. Like, okay, it's not from a place of fear and being like, okay, if I learn this about my genetics, it's like a stamp of what's going to happen, which some
Yeah.
people think that. It's actually gives us a tool to open up the genetic code, so to speak, so that we can see what's happening inside and to help us prevent things from going further. But it can also help us to see things that might be in disarray. Like maybe there's specific SNPs that are causing enzymes to not work properly, like vitamin D, and so that can be a lot of empowering knowledge for patients. So I work from that chronic disease perspective. And then I use the genetics as well as the naturopathic tools to have that holistic perspective. Does that make sense?
That is really interesting because you've got this very natural base with this really cool scientific digging deeper component.
Totally. I'm totally a
Yeah.
geek, a science geek.
I love that. So this whole area of genes is something that I haven't done a whole lot of reading on. I've done a little bit,
Hmm.
but I find it very fascinating because I've done this kind of genetic testing for myself and in my own health. And you're right, it can be a little scary because you're
Right.
like, oh my
Yeah.
God, that's really terrible. That could
Right.
make my life really, really crazy. So how do you okay, say somebody gets their genetic profile and there's kind of
Hmm.
these really, I don't even know, scary um, gene mutations or
Hmm.
SNPs in there
Right.
that can indicate maybe there's some causing some problems in the body.
Correct.
How do you let's talk okay, what areas do you look for? Like weight,
Hmm.
what? So what can genes tell you if somebody gives you their
Hmm.
genetic profile?
Right. So let's backtrack a little bit on that. So we're the genetic aspect of where we are right now is like moving at a very fast pace. Like even if you've had
Mm.
your genetic profile done, let's say 3 years ago, and you had it analyzed, that compared to today is a huge difference. And
Yeah.
so I even have patients that come in that have had that past genetic profile done, and I'll take that SNP information and then put it into my system so that I can see it from a new perspective, because we're seeing a lot of different
Yeah.
things. So that's kind of like step one, like
Okay.
basic, get your profile done and have that SNP data. Then step two is that we can then subdivide that data into different categories. So I'll do, say someone is coming into me, let's just say they're having a lot of inflammation. Let's just
Okay.
like that's simple. And so gut inflammation is an easy one to pick. So I'll look at different things, like there's specific panels I run, like a gut panel, or maybe
Mhm.
they're having insomnia and sleep and fatigue. I'll look at a fatigue panel. So you can take then the larger component of SIPs, which is huge, and subdivide it into categories that helps us to look at the picture based on that specific thing. So it really gives us very detailed information. And then we can use that information to see like what specific nutrients, for example, can help those specific SNPs that are out of balance, or what specific lifestyle. So dietary or, mindfulness techniques that have been studied so far that can
Yeah.
show to help benefit those SNPs. So the new data is just amazing, right? We're seeing, and it's coming so fast. So as a genetic lover and specialist, I really have to stay like on top of the information.
Yeah.
And I'm always like learning new things and like learning into new companies and figuring out new aspects of herbs and supplements that can help the genetics. Um,
So what is it about adding these things in, foods, supplements, herbs, that helps the gene not be such a problem?
right. Yeah. So I think a good example would be like, let's just take like two people, like let's just say John and Jane, for
Yeah.
example, right? So their genetic makeup is completely different, right? And
Mhm.
so if we did a panel of both of those people, we would see that what one person needs is very individualized, right? Which is
Right.
what naturopathic medicine is.
Mhm.
What one person needs is completely different than the other. So when we use that kind of like open magnifying glass and we look at the differences, then we're able to give that particular person. So, let's say Jane was having a lot of weight gain. And so she's like, oh, whatever I do, I never can lose weight. I've tried everything. I've tried exercise. I've tried, tons of diets. So then we can do a profile specific to weight loss and see, like, oh my gosh, your genetics show that you're not able to process carbs in this specific way. So it can really be a empowering tool for people, one, to help them to actually shift something they've been having problems with, but two, it's empowering because they might have put on like a stigma to themselves, right? That guilt aspect, like, oh my gosh, it's me, right?
Yeah.
Like everything I've done, nothing works, so when they actually find that like information out about themselves genetically, they're like, wow, this was something that I had control of, but I never really knew how I could, change it. So it's really empowering for patients to see that.
I was going to say that's kind of that empowerment factor of realizing, okay, there is something that I can do now that I
Mhm.
understand what's happening.
Right. Yeah. And exercise is another really key component because,
Yeah.
for example, someone like, I'm trying to lose weight and I do so much cardio, nothing ever shifts. And then we can do a genetic panel. We can say, well, this type of exercise actually doesn't help your body lose weight. Right. And
Yeah.
so it's like, oh, wow, I've been doing the wrong type of exercise for my genetics, and so I think this is a really huge shift we're seeing in the health field, is that when we actually use the genetic information, we can help people in a way that we never could before.
How wonderful would it be to have individualized medicine for everybody? If that was just kind of primary care, this is your
Mhm.
genetic makeup, this is what you, Sally or John, needs to be doing, exercise wise, food wise, etc. These are the herbs that are good for you. These are the supplements that are good for you. How amazing would that be? Like that's my dream world.
Right. Well,
know,
that's what
kind
I
of,
do. I just do,
yeah,
and there's a few of us that are practicing that way.
yeah.
But yeah, I think it's the medicine of the future, and I think it's cutting edge,
And I really hope that it is. I really,
Yeah.
really, really hope that it is because
Hmm.
one thing that I find very frustrating also is kind of this one size fits all approach
Right.
to,
Yeah.
this symptom, this is what you do for
Right.
everybody
Right.
without kind of digging to these deeper genetic causes or um past history, like you said, going back to 6 years old to see kind of
Hmm.
how you got here. What were the things that you were doing that maybe contributed to this? And again, not putting guilt on anybody because,
Right.
you know,
Which is
we don't
all
know
our life to go
oftentimes.
through.
Yeah.
Right.
Sure. I do really hope that is the medicine of the future. I think that would be very empowering for people. And we would get to the place where such chronic illnesses that we're seeing exploding in the population start to go down and down and down and down and down.
Hmm.
And that is something I kind of wanted to ask you, and I've asked a few other practitioners on the show before, but what, from your perspective, what do you see as being contributing factors or really large contributing factors to this explosion in chronic illness in the last few decades?
Yeah, I think that really comes down to toxicity. And I think that's from a physical perspective, from the
Mhm.
genetic cellular makeup,
Yeah.
but also from the emotional toxicity. I think both of those components, like if we look at, for example, the environmental toxins around us, they have accumulated. I mean, it's just like we're in a whole different environment than we were 20
Yeah.
years ago. So we're getting a lot more input, right, into the system. And then
All the time.
yeah, all the time, and
Yeah.
we're not able to process it because we're not doing like the measures we need to, some people say like or recommended at one point in time like okay maybe like a yearly detox is a good thing, right? So
Mhm.
now I recommend for patients like you're doing a mini detox once a month where it's just maybe like you're doing like 1 or 2 days to get some things moving through.
Yeah.
You're doing daily practices, but then every season you're doing like a larger detox. And that doesn't mean like you're, some people have in their mind like I'm going to be fasting, I'm not going to be eating anything, it's not like that.
Yeah.
We're just doing something that is helping the body to not have as much input. So we're reducing like, cleaning things that they're coming in and then helping to eliminate, helping the organs to function more efficiently, to be like
Right.
the liver, right? To help it to process. And then the other aspect I think is definitely the emotional component. So we're seeing things in our environment that one aspect is overload, right? We're
Yeah.
being surrounded by so many different technologies. But the other aspect, I think, is the inwardness because people are becoming more self-contained, right, in the way that they're communicating with,
Sure.
whether as communicating on a phone or in an email. And so they don't have that outward release of being able to in there, like we talked about earlier, Brandy, that
Yeah.
community, right? And I think when we make that shift, which I think we've seen that over the past 15, 16 months,
Yeah.
as we're moving into that phase of really starting to get back into community and turning to a friend or family member or your practitioner and being able to say like, hey, I'm not able to talk about this, I don't feel comfortable, right?
Yeah.
I'm not able to release it. And that emotional trauma piece is going to is a huge component to chronic disease. And not like bottling it up, right? And so
Yeah.
bottling up emotionally and physically. So I think those are the two components I see the most
Well,
with chronic disease.
yeah, I've talked to other practitioners who, and again, I haven't done a whole lot of reading in this area either, but kind of holding those emotions in certain parts of your body. So
Mm-hmm.
if you're holding on to these really negative emotions, it may sit in your liver. And if you've
Mm-hmm.
already got toxicity in your liver, that's just kind of overworking it too. And then, you know, not being able to kind of, yeah, detox, like just get it all out. And
Right.
that includes those emotions.
Totally
And
does.
so we don't really look at those as okay, yeah, this could be a big problem if I'm not getting everything out,
Mm-hmm. Right.
not only physically but emotionally.
Yeah. And when we're talking about autoimmune disease, right, which is a huge component of chronic
Yeah.
disease, it's autoimmune, right? So some part of yourself is
Yes.
fighting yourself. So that's that emotional key aspect I wanted to like get back to is that, when we're talking about releasing something, when we're looking at autoimmune disease, there's some aspect of ourself that's not happy with what's
Yes.
going on, right? And so we have to address that emotionally. It has to be 100%. And I work with patients on that on every level. When that's when they're bringing in their intake forms, I'm like, there's a lot of emotional questions in there to help
Yes.
stir that up.
Yeah. And you're one of a couple of practitioners that I've spoken to about that missing piece in autoimmune disease,
Hmm.
because that is a very confusing area, I think, for
Hmm.
people, because
Yeah.
there's not a lot of, you can go to your general practitioner and say, why did this happen to me? I don't know. I mean, that is the answer.
Right.
We don't know.
We don't know. Yeah. And we have
And
no treatment.
we have no treatment. Exactly.
Right.
Exactly. So to kind of have these deeper conversations and these kind of digging deeper tools to work with. For me personally, I struggle with autoimmunity. That was a huge piece for me. So I completely understand that, and I completely get that missing piece
Hmm.
of just being able to release certain things that you've been
Right.
holding on to. So I can
Hmm.
attest to that. It's just trying to get somebody who's held on to something for their whole life to
Right.
release it. That's really hard.
Yeah,
Or
it
to
can be
get them to
totally hard.
understand that that's a missing piece for them.
Right. Yeah. And they
Yeah.
might not have been ever taught the tools of how to release it. And,
Right.
it doesn't necessarily have to be this massive thing where you're like, oh, I gotta go, I don't know, live on a remote island and
Yeah.
scream my guts out for like like a year.
Although
It
that might be
doesn't.
nice.
Yeah, but some of us do need that, but
Yeah.
it doesn't always have to be that work.
Yeah.
I guess I'm trying, I just want people to realize when they're listening to this is that we can address things without it having to be this huge, like massive amount of work. There
Yeah.
it can be ease in healing
Yeah.
when we address it properly.
Right.
Mhm.
Right. Um, so there's something else fascinating that you do, and it's the quantum biofeedback.
Oh, yeah, that's fun.
Yes. So explain explain what it is exactly, and explain how you use it
Mhm.
and how it works for people, or use
Yes.
as a tool to work for people.
Sure. Yeah. Okay. So the quantum biofeedback is a system that I use, and so it takes the voice. So the patient will then like say repeat the vowels A, E, I, O, U, and
Mhm.
they do that for 15 seconds. Then I take that voice. Um, Recording and their picture of that moment, and then I put it into the system, and then it scans the entire body from the energetic aspect to the physical component, and it looks at like amino acids, it looks at looks at everything. It looks at the aura. It looks at minerals, vitamins, essential oils, herbs. I mean, it does a ton of different things. And then it can also do specific things like for the GI system, viruses and bacteria. So what it does is it scans it. So when you can think about, remember the, what was his name? Emoto, and he did with the water, the science experiments with water, and put like
Yeah.
a name on a glass of water, and then did a study where he could see how it changed. So your voice is very specific about what's going on. So the machine like reads that data based on the sounds of your voice. It analyzes it in different resonance of frequency. And so it'll like, if you're thinking of like a jagged line, it'll be
Yeah.
like, okay, oh, you just said this way, and this line will go up. Then it puts all that voice data and then kind of like analyzes it. And then I can go through and it does it from a range of like 0 to 700. And so the ones that are on the 0 scale and the 700 ones are the kind of like the ones that are out of balance. And so then I take all the ones that are out of balance and I put them into like a massive pot. And then it scans those and picks the ones that are the most out of alignment. And then it balances that with a frequency of sound to then attune the body to the healing of those specific things that are out of balance.
That is fascinating.
Yeah, it's super
So
fascinating.
is it kind of like energy blocks? Is it picking up energy blocks in the body? Like, hey, this is not
Yeah.
resonating. This frequency is not resonating in the body. We want to look here.
Right. Yeah, that's a good way to think about it. And
Okay.
it's like sound is vibration,
Yes.
right? So it's picking up a vibration that is not in alignment with its algorithm, right? So it says like,
Okay.
like 1, 2, 3, 4, 5. This is the algorithm for like vitamin B, right? And so then if that algorithm or that sound wave comes up, then that will be the thing that's out of balance. So I use it as with patients as an adjunctive tool. So, if I'm already thinking like these are the things out of balance, then I'll run the scan and see if there's maybe some things I missed that I might want to think about, use my detective hat for more
Yeah.
deeper diving. Or also I'll just use it for balancing. Like sometimes patients will be, this is going on. Can you just run a quick scan and help me to balance? So then they have an app that they use in conjunction, which gives them that sound frequency, that wave that they can use on their own and I'll have patients use it on a daily basis to help them each week to attune to that balance.
Wow, that is fascinating. Talk about
Yeah.
putting putting the health in their hands.
Right.
Um, wow. So when you get that information, like you said, you just use it as kind of a detective tool of where
Hmm.
we need to be focusing on, where we
Yeah.
maybe need to look a little closer at.
Right.
And and then when you're creating protocols for people, it then becomes very individualized as far as what
Hmm.
supplements, food,
Right. Oh, totally.
herbs.
Yeah. So say for instance, like when with herbs is a great one. So when I'll do a scan, say for instance, a lot of things came up as being out of balance that would be pointing to the adrenal system, like
Mhm.
ashwagandha and ginseng. I'm like, oh, okay, these are already ones that I was thinking of using with this
Yeah.
patient and they're like, but the scan will show the main ones that do the best work. And so
Mm.
then does that make sense? So they're like,
Yeah,
okay,
yeah.
these are the ones that are really going to help this person. So then I kind of I take that information. So I don't use it as a diagnostic tool. I
Yeah.
use it as a tool to um, affirm my original thought process,
Gotcha.
or using it in a way to like, oh, that's interesting. I wasn't thinking about that,
Kind of
So
investigative a little bit.
right. Yeah. Like, so like, for instance, like with biofilm, if it'll come up and say like, oh, this person had like Lyme and parasites and viruses are all coming up high on their scan, then it
Yeah.
makes me want to dive deeper. It's like, hey, is there a history of this? Have you had, what about parasites? Were you ever exposed? Have you had a stool analysis done? So
Mhm.
it allows me just a deeper tool and a really easy way. And I really enjoy using it with patients and they really like it too, is that adjunctive tool.
That's fascinating. That is something that I've not explored myself, but I feel like would be really interesting.
Yeah,
I've done a
it really,
lot of things
mhm.
in my own health journey. That is not one of them, but
Yeah, it's fun. I really like it, and the emotional component is really great too. Because
yeah.
it does essential oils, and it also does flower essences, and the aura, as I mentioned, and spiritual connection, and sacred geometry. So it does a lot of different tools for different things, which I enjoy.
So I'm going to transition into something that I guess could be considered controversial, but I think it's an important conversation to have,
Hmm.
especially since we're talking about individualized medicine, genetics being very different, kind of the bigger picture, and that is what everybody's talking about right now, and that's the COVID-19 vaccine,
Hmm.
and this being kind of pushed as a blanket. Everybody needs to take it willy nilly. How, as a naturopath, do you approach this with your patients?
Hmm.
Um, because I feel like, and quite honestly, I mean, I've spoken to traditional allopathic practitioners who want to give it some time and maybe wait, and then there are some who are just completely on board. It's the greatest thing ever. It seems like there's just it's really hard for people to make a decision. So,
Right.
from your perspective and from your medical background, how do you approach this?
Yeah, that's a great question, Brandy. So I think it really comes first of empowering patients with knowledge.
Yeah.
And when it comes to the vaccines, we are lacking in a lot of knowledge
Yeah.
because we haven't had enough time to completely study them, right? So
Right.
questions that my patients will ask are like, if I have currently have an autoimmune disease, what will happen to me if I have the vaccine?
And you
If
don't
I
have an
have,
answer to that.
but I don't have an answer. If I have a cardiovascular disease, what's going to happen? Will I have a? Is there more? Is it possible that I'll have a clot? So there is some information. We're slowly starting to get some information. If I'm pregnant, should I get the vaccine? How is it going to affect me? How is it going to affect my baby? We don't have that
I was
information
going to
yet.
say, I'm pretty sure those were not in the trial groups.
Right. So,
Yeah.
there's a lot of information we don't have, but we can make from the, like, not blanket, but from the overall perspective, we can guide patients, or I can guide patients in helping them to make intelligent decisions,
Sure.
based on their history, based on what they have going on in their physical body, and based on their environment, based on their work environment. And so I don't guide patients
Risk
on
versus benefit.
risk versus benefit.
Yeah.
Exactly. And so I don't tell patients my own personal vaccine choice.
Sure.
And then I also don't say, like, I recommend, I suggest they get the vaccine. I give them the data to help them make their own choice, which I have, like, on my website, to help them to see, like, this vaccine has been studied so far the most. This is the most data that we have. This is how you can educate yourself and your family to make the best decision for you. As far as, like, after effects of the vaccine, because they're not studied, by the FDA, or they're not FDA approved, we don't know a lot of information about what's going into the vaccines. What are the long-term side effects? Are we going to have booster shots? I mean, there's so much information we don't know. If a patient has had a history of reactions to a vaccine, I guide them on what could happen if they have the vaccine, what we can do to help them. So I have protocols for pre-vaccine, all the things that we can bring in to help them get their body prime to going into getting the vaccine, 1 and 2. And then also immediately, when they have that vaccine, things to help take their body to process. And then 3, post-vaccine, right? So there's some stages I'm helping patients with. And then if they don't want to do any of those, right, if they're not in the vaccine category, then helping them to supporting their choice, of course,
Yeah.
and then helping them to boost their immune system all the time with specific, like, herbs and vitamins, nutrients, environment, all those things to help support. So, that's kind of like the long-winded answer.
No, but I think that's really important, because I don't think many people are getting that support. What you just did and what you just said there was informed consent. This is what we know. This is what we
Right.
don't know.
Mm-hmm.
This is what could happen. This is what we don't know could happen.
Right.
Which I feel like there's not a lot out there. It's just kind of this blanket statement. Everybody needs to get it, where, in the world that I operate in our household, is that we question everything, like,
Right.
I want the facts before, and I take in all the information,
Mm-hmm.
and then we make a decision that's best for us. But it, like you
Right.
said, you don't say, hey, well, I'm going to do it, so you have to do it.
Mm-hmm.
Or even just kind of pushing it or not pushing it, or saying, don't do it. There's just a
Right.
lot of that out there.
Yeah.
And so I appreciate that approach of just, here's the information. This is
Right.
what we know. This is what
Mm-hmm.
we don't know. And then
Yeah.
you make the decision.
Right. And
So
coming
I
from
would love to
non-judgment.
see more of that. And I
Mm-hmm.
appreciate that greatly. And even the fact of you just having this conversation with me, I feel like is really important, because a lot of people
Mm-hmm.
don't want to have this conversation. It's
Right.
extremely taboo out there, which is wild to me. But it's an important one. It's a very important one.
It's super important. Yeah,
In
it's super
every
important.
area of medicine.
Right. Yes. And,
Yeah.
and vaccines in general, which from
Sure.
the naturopathic perspective, we have a lot of conversations with patients about vaccines.
Yeah.
And so I think maybe it's easier for us to have that conversation because we're used to it. We're
Yeah.
used to talking about the pros and the cons, especially with now where we live in 2021, where children and babies are getting so many vaccines. So we can help talk about what that looks like, how they can have a longer schedule. What if they they don't want to do vaccines, what are the pros and cons of that? So I think that the vaccine conversation, I don't know, maybe it's easier for us because we've been practicing it for longer.
Sure.
And I think an important thing about what you said too is that we need to have the conversation because we also need to provide the space for people who are being judged to not being judged, because health is very important as an individual and to be protected, right? And so
Right.
even asking someone if they have had the vaccine is an invasion of their privacy.
Correct.
And I think people are just starting to have that light bulb go off, and
Yeah.
if you don't, we have to be careful in our footsteps,
Yeah.
right? To not hurt someone in any way when it comes to the health especially from the physician. I have to, but also as an individual
Yeah.
being in space where now we're saying, like, if you can only come into this environment if you have had the vaccine, or not wearing the mask. So then it's creating a different type of persona for people.
It very much is. And it's a new scary landscape.
Right.
And I think about just kind of our own personal experience, where my husband works. They're required to track who is vaccinated and who is not, but they're not allowed to ask.
Mm,
It's just like the most wild thing ever, how
right.
you're supposed to track it, but you're not. Again, you cannot
Right.
invade somebody's personal medical privacy. You're not allowed to ask.
Right.
So there's just
Yeah.
kind of this crazy, weird limbo that we're in as a society, and kind of making people's choices, making them into a leper, or
Right.
kind of dividing us into these groups, which is completely unhealthy, and bizarre to me.
Mm-hmm.
Again, operating from, the space that I operate from, and that we as a household operate from. It will be interesting, and um, a little terrifying, if I'm being honest, to see kind of how this plays out.
Yeah, we'll just have to see, and I'm a big avid world traveler. So for me,
Right.
I'm used to kind of being having to show, like, I've had this specific vaccine for
Yeah.
traveling on my yellow card,
Yeah.
and I foresee that definitely it's not that far away from where we are now,
Mhm.
that when we're going to be asked to show that we've had a vaccine to travel, and so we have had already this in the past. I think that's one thing to just bring forward, is that we have had specific vaccines
Right.
required to make us go in a specific place. And that is just something for people to think about, like, oh yeah, this is not necessarily something new,
Sure.
but these are vaccines that have been around for a while and have studied,
Correct, and we've got
right.
some more information
More
on
data.
these.
Right. Yeah. Yeah.
Um, and I just had this thought and I lost it. Um, oh, the question of why, when we're talking about, you know, who's had it, who's had the vaccine, and who hasn't, in regards
Hmm.
to what they're able to do, why do you think we're not factoring in those who have had it naturally, who have had COVID-19 naturally?
Right. Yeah. Well, I think it's probably just part of the testing, and there's not enough studies done yet to show if you can then have the virus again. Right. There's so many different variables. Right.
Sure.
And the virus, as viruses do mutate, just like influenza. Right. We have
Right.
many strains, so
Mhm.
there's just so many things to factor in that we don't know. And I think there's also, the individuality of the person and how they think, and some people have different practices of hygiene and cleanliness, right? And the whole
Right.
thing is, we've been saying, like, wash your hands, wear a mask, all these types of things that people weren't doing. And so I think that we're going to see that. I don't know. I think it's just going to be a different an evolution
Mhm.
of how things will change in the perspective of just being healthy, right? As we talked about in the very
Right, I
beginning,
was gonna say,
right?
which is kind of what we were getting at to begin with, of,
Right.
this is the very basic thing that we need to be focusing on right now, and
Exactly.
that
Yeah.
has been
So,
my stance from day one.
right. Switching it over and saying, like, okay, what can we do like, with stress? How can we reduce stress so that our bodies don't go into this mode of possibly getting a virus for any illness,
Yeah.
right? Like, and I think that the workers that were our frontline workers, they were so stressed or still are
Yeah.
stressed. It was, and so overexposed. So there's a lots of different variables, where people need to have the help. And we're going to see again, like I said, that after effect and
Yeah.
after fall especially the frontline community and the doctors that
Yeah.
need to have that support after being, just I can't even imagine what they've been through.
It had to have been a really heavy burden and heavy load, and just the fear and unknown involved, and you're right, there is going to be kind of this long-term fallout that I hope that we can get a handle on
Mm-hmm.
now, or at least
Right.
quickly.
Yeah, and
Yeah.
the mental health field, I think, is seeing it the most. Like, haven't been able to refer out for counseling
Oh,
without
wow.
like months and months and months of wait. So, that's the field that we're already seeing needs to have more
Yeah.
workers and like to help that population. And I've been seeing that in my own practice too. Just like, hey, this is happening. How can you help? And so I'm glad I have that counseling training up my
Yeah.
sleeve.
Absolutely.
Hmm.
Well, again, I appreciate your work. I appreciate you having this very open, honest conversation and dialogue with me about some topics that are, again, hard to talk about, but are important to have. So I appreciate it so much, and I thank you for coming on.
Oh, you're so welcome. It was a joy to be here, and I appreciate the opportunity to talk about different controversial things because I think it's important.
Yeah, absolutely.
Yeah, and I actually enjoy it a lot.
Oh, well, good.
Yeah.
So do I. I
Yeah.
always have a tendency to ask those questions that people don't really want to talk about. So, before we started recording, I made sure to ask you though this time before
Yeah,
just like
right.
bombarding you. Like, are you willing to talk about this?
Right. Yeah, no, thank you. I appreciate that.
So thank you so much. And I will, in the show notes, add any of this pertinent information that you spoke about here, your website, and kind of the resources for the COVID-19 vaccine, and also a link. You have a book, right? That
I
we didn't get to talk
do.
about,
Yeah,
but
I know, right? You have to
yeah.
have me back on to talk about my book. Yes, my book is coming out. It was postponed a little bit now. I think it's supposed to be July the 27th.
Okay, so
Yes.
coming up.
Mm-hmm.
Very good.
Yeah, so I'm super
And
excited
the
about that.
title of that book is Detox, Nourish, Activate Plant and Vibrational Medicine for Energy, Mood, and Love.
Yes, I know. So it's all about DNA, detox, nourish, activate. So it's all about using specific modalities to activate your DNA. And so,
Oh,
yeah, I'm
fascinating.
super excited about it.
That's awesome. Okay, great. Well, so I will add that in the show notes too. And hopefully we can chat again in the future. This has been wonderful.
Great. Thank you so much for having me.
Thank you.